Bismillahirrahmanirrahim. Our subject today is lupus erythematosus. Lupus erythematosus is an autoimmune disease in which the defense cells of the body attack the connective tissue and organs. There are three types of lupus erythematosus, which are systemic, discoid, and subacute. Systemic lupus erythematosus is an autoimmune disease. In this disease, the immune system of the body mistakenly attacks healthy tissue. It can affect the skin, joints, kidneys, brain, and other organs, causing widespread inflammation and tissue damage in the affected organs. Discoid lupus erythematosus is the common chronic form of cutaneous lupus confined to the skin and is not associated with symptoms from other organs, and that is the most important thing, that it is confined to the skin only. It is less aggressive and rarely progressing to the systemic form. Subacute lupus erythematosus, lying intermediate between the DLE and SLE, non-scarring, non-atrophy producing photosensitive dermatosis, commonly developed in sun-exposed areas such as upper back, shoulders, extensor arms, and neck. Etiology, as any other autoimmune disease, is unknown. Most probable causes: genetic influence, hormones, environmental factors such as sunlight, infections, having infection with Epstein-Barr virus, cytomegalovirus, varicella zoster virus, and certain drugs and medications such as antihypertensive drugs, antibiotic and antipsychotic and anti-seizure drugs. Discoid lupus erythematosus, it is the chronic and localized skin lesions involving the bridge of the nose and adjacent cheeks. It presents with red inflamed cone-shaped patches of skin with a scaling and crusty appearance, most often on the scalp, cheeks, and ears, without any systemic manifestation. As we said, it is confined to the skin only. Rarely discoid form may develop into disseminated form. من النادر أنه يحدث أو يتطور إلى systemic form. Skin lesions occur on the face. It involves smaller region and cross the bridge of the nose, which gives butterfly distribution, and this is the most important feature of this type of lupus erythematosus. Discoid lupus erythematosus. This figure shows the cone shaped of the lesion and the butterfly across the bridge on the cheeks and on the scalp, and may cause hair loss. While systemic lupus erythematosus has a systemic features. Firstly, the photosensitive skin and kidney inflammation causes lupus nephritis, affect the lungs also, causes tachypnea, cough, pleural inflammation. Also other general symptoms such as weight loss, fatigue, fever, arthritis, emotional lability, hematologic disorders, neurologic disorders, and the most important thing is the Raynaud phenomenon, in which the limbs of the body such as fingers appear red or blue because of a spasm of vessels. The oral manifestation of discoid lupus erythematosus, which is the most important that we must concern about, the oral manifestation of discoid lupus erythematosus are referred as oral discoid lesions, and they occur in about 20% of patients. This may occur without involvement of skin lesions or before the skin lesions develop. Oral discoid lesions most commonly occur on the labial mucosa, vermilion border, and buccal mucosa. These are the most common sites of discoid lesions. Typical cases of oral discoid lesions are characterized clinically by the presence of white papules, central erythema, a border zone of irradiated white striae, and peripheral telangiectasia. Oral discoid lesions, these appear as a honeycomb plaques, raised keratotic plaques, erythema, purpura, petechia, irregularly shaped ulcers, and cheilitis. This figure shows that central erythema with a surrounding white striae, and peripheral telangiectasia. Oral manifestation of SLE, which is somewhat similar to that of DLE, uh, are frequently encountered and may include oral ulcerations, the most common, honeycomb plaque, as we said, raised keratotic plaque, non-specific erythema purpura, petechia, and cheilitis. Both xerostomia and hyposalivation predispose patients with SLE to dental caries and recurrent non-infectious pharyngitis and oral ulcerations, because as we know, the xerostomia and hyposalivation will make the body, the oral cavity, lack of any defense factors that present in saliva. So the oral cavity will be predisposed to many infections. Oral candidiasis and infections are also common due to the usage of corticosteroid, which is used in the treatment of SLE. As we know, the type of drugs that's used for such disease, autoimmune disease, is corticosteroid, and these type of drugs can lower the immunity of the body, so make it liable to develop infections. So oral candidiasis and infections are also common. This is systemic lupus erythematosus, oral ulcers, especially in the pellets. Differential diagnosis of oral lesions of LE: erosive lichen planus, leukoplakia, mucous membrane pemphigoid, erythroplakia, and squamous cell carcinoma. But many features can distinguish it from other types of lesions, such as in lichen planus. Lichen planus occur in symmetrical form, but LE lesions is asymmetric, and unilateral. The diagnosis must be confirmed. So must be confirmed by the presence of skin lesions. We must not look at only on the oral lesion. We must look at the whole body of the patient to exclude if there are skin lesions. And also, the spot diagnosis can be achieved by both histologic examination and direct immunofluorescence testing. Hope you enjoy these informations, and thank you.